Thank you. Good afternoon. So, I will talk to you about postnatal depression. But before to start, I would like to try to think with you the first time that you have thought to be maybe a mother. So we have to talk about when we were in the kindergarten. We were 5 years old, 4 years old, and maybe in that time we start to talk with our best friends, and we start to imagine, to fantastic about the life, about to be married to each other, and to promise eternal love. Oh my God, eternal love. And then after a month you have changed. And in that times also, you start to think, well, I could be a mother one day. And you start to play with your doll, and you start to to feed here, to feed there, and to change, and everything like that. And so, when you talk about to be a parent, when you talk about parenthood, normally people think about a good moment, a nice period. In fact, if someone here is a mother or a father, when we talk to the other, well, I'm pregnant. Oh, it's fabulous, great. I'm sure that your kids will have your eyes, or the eyes of your husband. And in that time, if you are comfortable with your maternity, with your moment, it's okay. You are happy, but sometimes you are not so able to understand what happens to your body. So I thought that to start, I wish to start with not with the same lines and sentences and everything like that, but I wish to start with some words that woman, is a little short video about women that suffer of postnatal depression. So if you agree, we could start with that.
Anxious, very depressed, extremely exhausted. Almost felt like I was detached from the world.
It was just a struggle every day, just to get up out of bed and to care for my baby.
I had intrusive thoughts. Yeah, I had those fears like, oh, those are terrible, because it comes to your head, it comes to your mind, and you just want to like brush them off. So you try to brush them off, but they don't go.
Postpartum depression is something that I went through 20 years ago. It was debilitating, and when I was going through it, the shame that I felt after having a wonderful baby was overwhelming. I remember waking up with contractions and being really happy because I knew I was going to get the baby, and then after he was born, I didn't even want to hold him. So something happened to me right away that I really didn't understand. I could see the joy on my husband's face, and I didn't feel the joy. I was like, where's my joy? I felt like I was selfish. I felt like a waste of a human being. I felt like I wasn't kind like a mother is. I wasn't caring like a mother is. I just never knew I was that selfish, that I couldn't love a baby.
I went on the internet and I started putting all these different symptoms in. They came up with schizophrenia, bipolar, this and that. And it freaked me out to the point where I better go to a doctor and let them diagnose me rather than sit here on the internet and scare myself even more. So that's what made me go get help.
I knew I needed to talk to somebody because I had these thoughts and feelings that I just knew weren't right, and I felt like I needed to get some kind of reassurance that this was going to be okay.
I went to the doctor, to my gynecologist, and I say to him, you know, I'm having all these symptoms. I don't have appetite, you know, and I have.
After I went through treatment, I finally realized what it was like to be a mother, and I was relating to other mothers for the first time when Kevin was about a year old. I understood the joy that I thought that I would never feel. I started to feel joy, and I couldn't wait to be with him and go to the park with him and do the things that all the other mothers were doing.
Once I got help, I started to feel better almost within 2 weeks' time. You know, once you realize that you're not alone, you know, you start to get a handle on it.
Well, now my son is 15 months old, and a lot has changed for me. I look at him and I can't believe I felt anything than what I feel for him right now, which is just unconditional love.
I remember about 2 months after I was taking the medication, I saw my baby, and I look at him with different eyes. I look at him differently. It felt so one emotion that I never felt before.
Through counseling and medication, I finally was able to feel like myself again and be the mom I always wanted.
Okay, I think that this video is a free one. Okay, you can find it on YouTube. It's a longer one. I cut the part that I wish to see with you. I think that is really impressive because we see 3 stories, 4 exactly, and 4 mother. And the first woman of New Jersey said, when I feel the contraction, I was really happy because I knew that in a moment my baby would be here with me. And then when I had to hold on him, I couldn't. You can't touch your baby. Normally, when you start to suffer something like that, normally the postnatal depression, we have some signs when the woman is still in pregnancy. In this video, we see only the mother, but we know now that the postnatal depression is also for the father. Not only because I'm a man, but it's true. And then another thing, everybody here, I think, is professionist, is a provider. We work in mental health or something like that, or university, and we study many things. We study postnatal depression, for example, me. And so I wish to start, before to arrive here in Athens, to see how many articles in 2 databases, PsycInfo and Medline, has been written about postnatal depression in the last 4 months. Well, we should start with a long list. This one is 25, then the other one, we stop at 48. Now we have 48 scientific articles about postnatal depression, but the last one has been written the 11th of May. Well, so many articles, as if you don't put a limit in your researches in the database, you find 1,000, 2,000 articles in 2 or 3 years. And so all the researchers, and mine too in some way, start to say that there is a big problem that in not all countries is seen, and not every scientist start to study with this point of view. So we should to talk about the postnatal depression. Some lines, because to say that normally we don't know where exactly start the postnatal depression. We know that it's a biological and social and psychological changes that start with the birth, but before the pregnancy of the mother. And then often these symptoms start to become in a depressive way when the child born. And so the postpartum normally should be an happy period, and really happy period. But if you are not happy, and somebody else tells you, oh, you aren't happy, well, you are a mother, so you should be happy. Everybody tells you that you must be happy when you have children. And so you start to think, well, I'm not so happy, but what can I say? Maybe the woman in the video said, I thought that there was something wrong with me. And in the last woman said, I start to see my baby with other eyes. Because in that moment, the woman and the father, if it's a depression, she can't see the babies. But see only a part that damage the body. And so, normally, the postnatal depression can have 3 sorts of evaluation. The first one is, well, quite normally, it's called baby blues. Maybe everybody here knows that. Or blues maternity. The second one is postnatal depression. The third one is the awful part of the postnatal depression. It is postnatal psychosis. At first, maternity blues. Normally, the 50% to 80% of women suffer in the first days of something that is strange for her, because you know you are excited after your child is birth, but after a moment you start to I don't know what to have to do. I don't know, I'm a new mother, I'm a new father, and I don't know what to do. So normally you can find a woman that just starts to crying, but I say it's normal for the moment. When you start to see that symptoms, and which symptoms you can find? Well, you can find anxiety, because you are a new mother, you're a new father, and you don't know what to do. Well, in Italy, I talk about my reality. We have many courses about how to be a parent, how to be a good mother, how to be a good father. Well, I think that we really can't do how to be a good parent. The colleagues before me talk about alienation and talk about stress index and the episode they are stressing. Well, all this part of the real life of the people could be included in this part of anxiety. And then also the woman can have a decrease of concentration, or again, can have a tearfulness, or crying spells, or mild mood swing, or irritability, or insomnia. Well, everything that symptoms we can find in a woman after birth. But normally, these symptoms disappeared in 3, 4, 5 days, not more. And so the woman start to become a mother, and the father start to become a father. And then the postpartum depression instead is, well, fortunately, is not so high like percentage, like maternity blues. We know that the researchers say that normally is about 11 to 15% in the population. So if we think it's not so much, but well, it's a great number. It's really a great number. And we can imagine how much money we could not spend for the treatment after that the woman and the mother and the father have the baby, if we start to prevent. Okay, this is the part, we talk about this later. And what are the symptoms that we can find in postpartum depression? Well, normally the symptoms are onset, well, in one day, or in many cases it happens several months following delivery. So not usually that a woman that is not present these symptoms in 1, 2, 3, or 4, or 5 days after birth, normally she doesn't present this symptom again. But maybe it's possible, because all the researchers, all the literature said many things, many different points of view. All the studies that you can find, many studies you can find, are not comparable, because they use different tools, they use different periods. They start to evaluate the postnatal depression when the woman is pregnant, and they start in 1 year after birth, after delivery, or they end this administration after 1 year and a half. And so it's really difficult to know that. But some symptoms can be changes in somatic function, or intense hunger and irritability. Well, these symptoms are really like the symptom of depression that we can find. One that is, I think, really important is this one: hopelessness, helplessness, and guilt, lower self-esteem. Because that woman has a sense of guilt. I am a woman, I should be happy, I have a child here, and I should be a good mother. But I can't. I really can't. And so, when in that moment, if she's alone, she can't do anything. You can imagine the baby is in the other room, is crying, and the mother doesn't recognize the sort of crime that the baby do. And so what I have to do, what I could do, but in that moment there is no answer for that woman. And if she's alone, if she is, well, she has a partner maybe, but she is working, and what she has to do? In this case, it's really important the family, the grandmother, the mother's mother, the mother's father, etc. And in some cases, we can find also some suicidal soul. And this is the awful part of postnatal depression, because we have the cases in Italy 1 month ago with a mother, 35 years old, that she started to have a suicidal soul. But at the end, after months, she decided to suicide herself, but with a baby too. And so when the doctor, when the police talk with the neighbors, say, but the woman, what do you say about the woman? Was no, oh yes, she was really kind. She was, well, sometimes she stay alone. Sometimes, well, she doesn't talk so much. But, well, if I think now, I listen many times to baby crying. She was a lady that she wasn't married, she was alone. And she decided to end the life in that way. Again, the postnatal psychosis, post-depression psychosis, usually is 1 on 1,000 cases, 1,000 persons. So it's not so high the percentage. And which are the symptoms? Well, I can say that it's normally the same of we see before, but is present also an illusion about herself, about the self-esteem, and also hallucination. While the postnatal depression is not so terrible, okay, so high level, we can think to treat it with some psychotherapy. In the cases of postpartum psychosis, we need the hospitalization because the woman can be hurt herself, and in some cases hurt also the partner or the babies. And so, what else? Well, the etiology. I say to you that we still really don't know where the postpartum depression starts, where, when, and which are the factors. We know that we can have some risk factor, and one, for example, there are, I think, 49 or 50 risk factors, probably, possible, etc. And I brought here only the one that I think that are most important for the part of research that we present, is the preterm birth. Because when the preterm birth is born, so the mother is still in the hospital, and the baby, normally, the mother can't touch the baby, okay? And again, also other problem, or a physician problem, and familiar implication. Familiar implication means partner depression, or to have experienced in the last year some death in the family, or some high stressor, or again, to be alone, or infant development. If the baby doesn't grow up like the mother wanted, this could be another problem. But I think that it's important to say that that mother should be helped to grow up the children. So, why to say all that before my research? Because this is a part of a larger program that we had with an Italian hospital near Turin, and we started it in October, and it should finish next October, this year. And because in that hospital, they evaluate so high level of postnatal depression, and also some problems with the father of the newborn. And so they asked to our department to try to work with them and to try to evaluate the postnatal depression in some cases. Here, the aim is, the first one, our objective, is to explore the maternal and paternal perception during the pregnancy. We had 2 times, times 1, 6 months during pregnancy, and the second time is 2 months after delivery. And the second objective is detect the presence of risks or protective and factors associated with postnatal depression in pregnancy. Our tools, we use the EPDS. Well, I think that everybody here knows the EPDS, but if doesn't, we will talk about the State Trait Anxiety Inventory, the Center for Epidemiological Study Depression Scale, the Headache Adjustment Scale, and the Marlowe-Proud Social Disability Scale. The EPDS is a questionnaire self-administered that is done with 10 items, and normally is a self-report items with a focus on the emotional and cognitive characteristics of depression. And the authors say that Cox, we can use these tools also when the woman is pregnant, because the index are the same. So the PDS screening instrument is a score about, well, equal or measure of 13. In Italy, our cutoff for to say that a woman suffers of postnatal depression, the authors decided with the validation to put a night point is 20, 1920. The STAI, to measure the anxiety. The CESD is a self-reported questionnaire for assessment of depression, general depression, and the 20 item. The DAS is an instrument that we validated last year with a colleague in our office, and is to measure the dyadic consensus, the dyadic satisfaction, and the affective expression and the cohesion of the couple. We decided to use these tools and not many other tools about how the couple function, about the marital status or many other instruments, because when we contact the authors and we talk to Spaniard about the research, he say, well, maybe this could be a good instrument for you. And then the last one is the Crown-Marlowe to measure the social disavailability independent of psychopathology. So, only here, the criteria. Well, the criteria were fixed address, the ability to speak and understand Italian, the absence of psychiatric disorder stated, no psychopathology was held, also was sought participant of the two couple. We start and we have now 90 male and 90 female, 90 couples. And in the first step, we ask about 185 couples to participate to our research. And they say, yes, very, very glad to participate, very glad to help you. And then the second step, they didn't answer. And so, okay, you have 90 cases that you have to put in the other side. So, in synthesis, these are the points of the alpha chromback of the instrument that we have used. And we can see, we decide, and we can see the mean and deviation standard doesn't change so much. Well, decrease. In the other parts, we can see we try to do the ANOVA to see which are the correlation. And the significance is about state transitivity, the trait anxiety, the CSD, and this is what the first part we want to try to prove. And the second part, we have done the Bonferroni test to try to evaluate with regard to state anxiety. There is a significant difference between the mean of the group of the mother and T1, with the mean of the group of the father T1, and still a significant difference within the mean of the group of the father T2. Instead, the trait anxiety of the group of mother T1 shows significant difference between the means with the group of the fathers T1 and the fathers at T1 with the group of the fathers T2. And as regard the group of the mothers at T2, there is a significant difference between the mean of the group of the fathers at T1 and the group of the fathers T2. Well, obviously, for research, you have to write all these numbers, T1, T2, P, the Bonferroni test, and well, it means that there is a significant changes. And the mean that we have found, there is a strong correlation, and obviously we will try to understand which correlations are so close. And the CAD scale of the female group shows significant difference between the male group at T1 and the male group at T2. In addition, the women's group at T2 has a significant difference, the average male group at T2. Well, a funny thing is that in one item is about how is your partner. We had asked this question to the mother and this question to the father. How is your partner after the delivery? And normally the mother answer, well, I'm not so bad, quite good, 80%. And the father said, well, she's normal. She's like ever. Well, maybe she's changing in some way, but I don't know what is changing. Well, it's strange. So for sure we will have to ask again and to try to understand what does it mean. And the EPDS scale of the group of mother 1 shows significant difference with the mean of the group of father at T1 and the group of father at T2. In addition, the group of mother T2 shows significant difference with the group of fathers at T2. So, in conclusion, the results say that the first aim, our first aim, was to have a higher score that man at the scale of sexual activity, but also in the scale that measures symptom of depression in depressed postpartum depression. The second aim, women with depressive symptoms during the period of pregnancy and in postpartum, pregnancy unexpected or unwanted. This is really important because if the woman doesn't, or the woman and the man, the future mother, future father doesn't, they don't have a place in the mind of the children, well, this could be a sign, a predictor of something that could go wrong with the maternity, with the parenthood. Because when the mother start to think the child, start to think the names, start to think the colors of the eyes, start to think everything about him, also the father. This is a place in our mind. And also, in urgent cesarean delivery, we can imagine why. Because the woman arrived in the hospital and in time zero, she's well, in the operatory room, and well, when she opened the eyes again, she has the baby near her. And it's strange, because you don't know what happened in the time that you're asleep. And it is really particular, because I think 10 years ago, we made a research about the urgent cesarean delivery. And the 85% of women that had a delivery, cesarean urgent, in the next days of the operation, they have a little capsule, a little protuberation on the cicatrice. And when they talk with us, with the psychologists and psychotherapists, they spend many times to caress this part of the body that normally the woman caresses when is pregnant, to feel the baby into. And so, what we could do? Well, obviously, I think that we have to do prevention. We have to do prevention because one day we could have a child or some friend of us or something like that. And maybe to see this sign more often, and one day, maybe a baby, will thanks to the mother and thanks to the father. Thank you to you.